Good evening, or hello, I should say, because who knows what time it is where you might watch this from. So, my name is Laura. I am a registered nurse. This is Healthy Carnivore. I'm just going to go over some stuff tonight. But first, a little background on myself. RN, been an RN. I've been a nurse for over 22 years and started out doing keto in 1991 before it was really called keto. And switched to carnivore in 2019 and then lion diet, just a stricter version of the carnivore 3 years ago. So that's just kind of my background. I've done all types of nursing except for OB and pediatric. No, thank you. Anyway, so this is a pretty big subject. I think there's a lot of issues out there. There's a lot of shaming in the carnivore and keto world space. I've had some people that were very dogmatic about you can't do this and you can't do that because doing carnivore will fix everything. And I do think it allows your body to heal the things that are broken. Menopause is not that you're broken, it's a natural way that your body is shutting those things down. And it's whether do you want to live with the symptoms or do you want to do something potentially that can help. So I'm going to go over some of that stuff tonight, and I'll try not to take a too awful long time because I know it's getting up to the holiday weekends for Easter. So I'm going to go over common menopause symptoms, even in people who have done keto and carnivore. And I'll have some people who say, well, if they did it perfectly clean, they wouldn't have that. Not true. I had those symptoms and I am as strict, and especially during 19, 20, 21, I never ate a pickle. I mean, it was literally only meats and eggs. Um, no cheat days because that's not my personality. I don't cheat. And not to say that that's bad if you do, I just don't because I'll go right off the rails. So I just never have done that to myself. Now I can have an occasional fermented dill pickle, fermented cabbage, a bite here or there. I'm never going to sit down and eat a bowl of it because I think I would probably die, but that's just for me. So even on a clean lifestyle like keto or carnivore, most women can still experience the hot flashes, the night sweats, sleeping issues, and a lot of this, not only insomnia, but where you wake up like 2 to 3 times in the nighttime, almost always between 2 and 3 a.m. It's just kind of a common thing. Mood swings and anxiety, vaginal dryness and lower libido, lower sex drive, weight gain, especially around like the belly fat area, no matter the amount of fasting, any of the things that you normally would do that would kind of help get into that fat burning and really get that cleaned out. Brain fog or memory issues, fatigue, joint pain, and stiffness. All of these are signs that could be menopause signs. Okay, it's perimenopause, menopause, whichever. Perimenopause is being seen in people as early as 30, especially because of the bad diets that we've had, back in the day. I would say the majority of hysterectomies that I know of in my area were in their mid 30s, 32 to 37, lots. And I'm one of them, unfortunately. Even doing keto, I still had a bunch of issues. So, clean eating helps reduce the inflammation. Of course, we all know that, and it can lessen the symptoms, but it cannot replace the hormones. The higher fat does help with what hormones you have in the body, and your adrenal glands can put out some of these hormones, but not to the level of what your ovaries were able to do before. The progesterone, the estrogen, testosterone, it just can't. So there are some options. So I'm going to go over those right now. Hey, Tara. So bioidentical hormone replacement therapy is called BHRT. It uses hormones that are identical to those that the body used to make. It's different from the synthetic, not just hormone replacement. bioidentical. So these can come in pills, it can come in shots, it can come in creams, and it can come in pellets. There's lots of options out there. Can come from horse, can come from cow, can come from pig. Just depends where your person gets them from, where you get them from. Most of the time, you're going to have to get a functional, holistic, integrative doctor to get this for you. And you can do that. You can type in, like in your area, you can type in bioidentical hormone replacement therapy specialist in my area, and it's going to pop right up. It's going to give you multiple places to look at. So, my thoughts on the bioidentical hormone replacement is it can be life changing if it's done correctly. And a lot of that is going to be very key, but just like everything else we've had to do when it comes to labs, you want to make sure that somebody like you that is clean eating, you're trying to do all those things and you're trying to optimize everything that you can use this stuff. So it's about optimizing what you are already healthy wise. It's not trying to mask a bad diet. It's not masking bad behavior. It's not masking something that you did. This is a natural thing that happens. It's just that who wants to be miserable all the time? Um, so good options for, clean living women, and breaking it down by hormones. Okay. So, progesterone, the best option, they say, and this is several different researchers, all men, may I say, because I did look and I was like, really? There's no women researchers looking at this? I want to know what they think. It's kind of, yeah. Anyway, I won't go into that. But best option is, they say, is oral bioidentical progesterone like prometrium or compounded micronized progesterone. I will tell you right now, I'm not a doctor, I am a nurse. I do not agree with that. Now, that's what the researchers say that are all men. Um, I don't think that's the best. I think creams and I think pellets um, are the best, just from my experience of working with that and working with people. So, what progesterone does for people is it's going to help with your sleep. It's going to help with your anxiety, your mood, and it's going to help balance your estrogen. The cleanest version, um, if you're going to do the oral, is you want it compounded with olive oil or MCT oil. And that's up to you. Maybe you like taking pills versus that's not for me. Um, I just don't want something to have to go from my hair top to my toes to get to what I need. I prefer differently. So, estrogen is, they have transdermal patches, they have compounded creams. So, all of this is going to come through a compounded pharmacy. Yes. Um, not the shots will, the creams will, the pills will. The pellets you get through one of these functional doctors, and they actually do that. And I'll explain to you how that works. So, with the estrogen, this is really going to help with your hot flashes, your mood, the vaginal health, brain fog, and help with your bone health, increasing your bone density. They say the cleanest version is the compounded estradiol cream in a base like organic oils or emu oil. This again, I just think that that's an option. I think there are, like I said, there are also the injections, there is the pills, and there are the pellets along with the creams. Testosterone, compounded cream or subcutaneous injection, low dose. And then it has pellets, and they also have the tablet that you can do. So it improves your libido, your energy, your strength, and your mental focus. How come it doesn't work on men like that? Mental focus. Well, I guess it didn't say memory, right? I'm just kidding, guys. The cleanest version, they say, is going to be based in an oil, or if it's the injections, it's going to be preservative free options. Most functional holistic doctors are going to automatically do that. They're going to do the cleanest versions, but I always would ask. So, Faith says, "Hi, late in the game for me, but I wouldn't know if I need it." This is not just for you're starting to go through menopause or you're in menopause, it's for post as well. It is never too late. I mean, if I'm 90, I'm probably not going to do it. If I'm 80, maybe, depending on what my symptoms are. Um, so, bonus tips. So, there are things that you can do. So, first of all, you want to make sure they're going to test all your levels. Make sure to call ahead and ask them, like, am I supposed to fast? Am I supposed to work out? Can I have coffee? Some of these things. Make sure you know what that lab wants you to do so that you don't mess up your, you know. And if you're taking something like pregnenolone, there's a couple different ones, DHEA, stuff like that. Those things they do want you to stop before they test you. That I'm positive. Another one is starting low and going up slowly as you need to. You don't, you're feeling like crap, but don't just be like, yeah, 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 I want this, I want the most of everything. Because you will find doctors who are going to just, oh, okay, we'll just give you the high dose. Well, that may not be what you really need. So I would always start with less and then kind of build yourself up. Um, as I said, find a functional or integrative doctor who supports your lifestyle as well. My OBGYN that is a functional holistic is also carnivore, so works out perfectly. Track your symptoms, not just your labs. So you'll want to track what symptoms you have. You want to take them with you to your first appointment. Then, yes, they're going to do your labs, but you need to be keeping track of um, of all of that. Okay, you want to know, like, now that I've been on this for, like, say, the pellets are 3 to 4 months, you know, are you feeling better? Are you sleeping better? Are you having decrease in any of these areas? Because that'll tell you kind of which thing, do they need to come up on one, go down on one, stuff like that. Um, let's see. Let's see. Oh, the other thing is you can make up like a menopause tracker. This says to do weekly or monthly. I don't know too many people that want to do this for like 5 6 months before they go have something taken care of if they can possibly help it. But you could rate from 0 to 10, like hot flashes and night sweats is the first one, sleep quality, energy levels. This is a long list. Mood and anxiety, libido and sexual function, vaginal dryness, weight and bloat, brain fog, memory, joint or muscle pain, hair thinning, hair loss. This is a big one. Okay, so you can do this, excuse me, where you write those all out. You can go back and listen to this again if you need to that spot and write those down and then do a 0 to 10. Like, where are these? These are things that you want to take in when you go to the doctor, but you also want to have for yourself. Um, so let's see. Yeah. So, like, if you woke up 3 times in the night, if it was 2 to 3, you want to add that on there too, not just that you woke up. Um, so, yeah. So, blood test. So this just depends on, like, I have a hysterectomy, so I don't have a uterus. So they're never going to do progesterone for me. I wouldn't progesterone cream. There's very little benefit, little bit cardiac benefit to having it, even if you don't have a uterus. But if you have one, then that is something they usually like to do. If you still are having periods, they normally want to draw your blood between day 19 and 21. Now, if you aren't having cycles for the last few months, it's not going to matter when. Okay. So I'm going to give you a list of the hormones that you want to ask for. So I'm going to say this a little slower so you have time to kind of write it down. Kat says, I was on and off keto when I started menopause and it wasn't bad, just a few hot flashes. Oh, awesome for you. That is good. That is good. Mine was really, 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 really bad. That's kind of when I went carnivore, and got a lot better. And then, 6 months ago, started kind of getting different symptoms, um, and then had blood work done for something else. Actually, it was just all inclusive, where I work, because I work at a health department. And they were like, oh, you're this and that and everything. And I was like, of course it is. Why wouldn't it be? And I'm like, dang it. So, okay, the first one you want to ask for is, it's either called E2. Some labs will call it E2 or estradiol. Progesterone is the next one. Free and total testosterone. DHEAS. So SHBG, sex hormone binding globulin. FSH and LH. That'll only be if you're still having periods for that one. If you're not, they're probably not going to draw that one. Cortisol in the morning. So these labs do have to be in the morning. Thyroid, it is always a good idea to have that thyroid checked out at the same time. So TSH, even though that comes from the pituitary, it's not a thyroid. It's what makes the thyroid do what it's supposed to do. Free T3, free T4, reverse T3, very important. Almost never done unless you request it. Thyroid antibodies, so like TPO and TG are other ones that you can ask for. Other helpful markers that'll kind of give them an idea of your basic overall health, unless you had these like really recently, have them add these into your labs. Vitamin D3, 25-OH is another thing that they call that. HS-CRP, that's an inflammatory, looking for inflammation. Fasting insulin, hemoglobin A1C, and lipid panel. And we all know as carnivores, we're not worried about the lipid panel per se, but you need to make sure you have enough LDL and cholesterol in the body to do what it needs to do to help with these hormones. Okay. I personally, like I said, I'm a nurse, I'm not a doctor. I'm not telling you what to do on this. For myself, if I was going to do anything like this, I would make sure I was not taking a statin, because it's going to block how well any of this stuff works, because you are blocking the cholesterol, and you need the cholesterol for the sex hormones, whether you're making them or if they're putting them in, on, however you're getting them. Okay. If you're interested, there's also a Dutch test. That is where it's actually a dried urine test that they can do. It shows how your body is actually metabolizing the hormones. It's good to see if you're clearing out estrogen or if you're making cortisol. And there are some people that I know very closely, that I talk with every single day, that I think probably have the cortisol, is too much for them. I think that might be an issue. Um, and I haven't forgot the men, so the men in the back. Um, Signs that a man may need bioidentical hormone replacement, even if eating clean, eating carnivore, whatever it may be. Signs that they may need that are low libido, erectile dysfunction despite good diet and fitness. Doesn't mean it's the only thing that can cause that, because that can be peripheral vascular disease. There's all kinds of things, microvessel disease, but that's one thing. Low energy, fatigue, sluggish, even when they sleep for like 8 hours straight. Mood issues, irritability, depression, apathy, where they really don't give a damn. I have apathy sometimes. Not with my patients, though. Okay. Muscle loss, can't build or maintain mass, brain fog, poor focus, mental edge, dullness, increased belly fat that they just can't get off no matter what, poor recovery after workouts or after stress. So the labs that I would do for a man would be total testosterone, free testosterone, SHBG, which is the sex hormone binding globulin. It affects the free testosterone. Estradiol, E2, because men do need a little, DHEA-S, and then LH and FSH check. Primary, that's just kind of checking for primary versus secondary hypogonadism, because that can be a thing. So, some other things they could get would be in the morning, have your labs drawn in the morning, cortisol, TSH, free T3, free T4, reverse T3, vitamin D levels, ferritin, homocysteine, lipid panel, fasting insulin, and A1C. So very similar to the same stuff. The bioidentical replacement for men is testosterone. They can do cream, they can do gel, they can do sub-Q or IM injections, they can do pellets. Um, the cleanest, you want to do the cleanest preservative free compounded anything when you do this. Um, so let's see. I think that might be the majority of that. So, and the same thing for men, they can do that symptom tracker, just symptoms, of low libido, energy level, muscles and strength, mental focus, mood, irritability, sleep quality, and recovery time. Um, for men, sometimes oral DHEA, and they can work with their provider. Sublingual low dose will help with them. Progesterone. Some aging men benefit from low dose nighttime progesterone to balance the estrogen because they do have some to help sleep, though it's not as common as it is in women. But very somebody with a lot of adipose tissue, a lot of fat tissue, will produce more estrogen as well, which is why people have like polycystic ovarian disease. One of the things is because they are just producing. um, Monitor on their estrogen, monitor, not eliminate. Some guys aromatize too much of the tea into estradiol. They may need some lifestyle tweaks or minimal natural aromatase inhibitors. So, keto, carnivore do sometimes help balance this out for men completely. They don't need this as much of the stuff that we do, um, and their stuff works till forever. Yeah. Ours does not. Not sure why that is. We outlive men, most of the time. It's not fair. Anyway, so with the creams, like I said, they will send a prescription to the pharmacy. They'll make up a cream, they'll send that out to you. And you can apply just exactly as they say, or if it's a patch, if it's pills, you can do pills. If it's pellets, what they do is they numb a little area on your butt cheek, kind of over by the crevice, and they just make a little teeny incision, little, about big enough to put a toothpick in, maybe just a teeny bit bigger than that. And then they will put 3 to 4 pellets in, depending on what hormones you're getting. And they base that on what your labs show. And they place those down. They take a trocar, which is a pointed device that allows something to go down the center of it into a spot. And then you can take the trocar out, but the thing they put through stays in place. So that's what they use to put those in. And they put those in every 3 to 4 months. And depending on your practitioner, how often you have your labs done, usually you will notice some kind of difference immediately. Like within hours, you're going to, like some people, have really cold hands, cold feet. That was one of their things, a very low libido. And they're like, you do not want to know what happened that first night. And I was like, no, I don't. You're right. La, 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 I don't need to know. But they were like, my hands were warm and my feet were warm. And they're like, I didn't even notice that. And then they talk about, am I, not right away, but this is months down the road, like all this new hair growth that's come back. that they had lost, thicker hair coming back, the sleeping issues, the muscle, you know, um, because like, I mean, I can keep pretty good muscle from working out, but I mean, not like I did, when I was 40, you know. Um, so anyway, these are just ideas. These are things that people can try to see if it gives you any benefit. Okay. Let's see. Kat says, my doctor won't let me do a thyroid or sex hormone lab, so I am going to use on your own labs. What do you mean your doctor will not do it? I don't. Oh. Okay. So when you do your own labs, make sure that you have a lab core place in your area and you want to call them before you buy your labs and um, you want to make sure that you call them and say, I'm getting these from Own My Own Labs. Do you guys take those orders? Because they don't always have a diagnosis code on the order. Some places will take it. I have found that the lab cores that are kind of connected to hospitals or clinics sometimes will not take it if they don't have a diagnosis code on it. Other standalone labs, like you'll see them, like Iowa City has a standalone lab right there, and they would do anything that comes out of, own your own lab. So I would just do that before you purchase the orders for these labs, so you don't lose your money. So Kat said, yeah, she said, I don't need it. Okay. Well, you're a nicer person than I am because she would be fired. Um, and maybe you don't have any symptoms right now, but why wouldn't we do something preventative? At least know, like, are my numbers starting to decline? Because there are some natural things, like I said, that pregnenolone, the DHEA, some things like that. There's some other things that you can do naturally that can kind of help with that. Uh, Kat says she stopped going to that doctor anyway, or the doctor, or I stopped going anyway. Yeah, I would find somebody else. It's just not right. Really, they always use this, well, the insurance won't pay. The insurance, I can promise you, we have labs come in to Hancock County Health Department, and they're like, do you know what this lab is for? And I'm like, never heard of that before in my life. And they don't have any diagnosis, that you would think would go with that lab, but that person wanted it. Run the damn lab. And guess what? The insurance has always covered it. I have not seen it not saying they won't, that they may not do that, but I mean, you don't have to, and that's the thing. They've attached these diagnosis codes to everything, to the payer, to the insurance, to the actual orders. It didn't used to be like that. Basically, you got labs, you just got your labs. You asked and you got your labs. You didn't have to go through these, I don't know, that's red tape. And it's just so that these people have a job, I guess. That's the nicest thing I can say. So I have some crocheting to do tonight. And then this Sunday, which is going to be the 20th, I think. I don't know. Anyway, this Sunday at 4:30 Central Standard Time, I will be going live with Robin and Denitra. And we will be going over some lab work of Robin's over prior, and I think either prior or maybe right when she started compared to now when she just got it not too long ago. So um, we're going to get those and go over those. So that'll be entertaining. That'll be interesting. And then, yeah, so just come watch. If you like this, please like. If you want to subscribe, that'd be great. And please share it out. If you know anybody that's having these things, I don't want people they're totally shamed into never doing anything like this for their betterment. I'm not a fan of the pill forms of any of that stuff, but I'm also not having those side effects. I'm not having those issues, but I sure would probably do cream, patches, and pellets. So let's see. Tasa says, I have had hot flashes since May 2010. Oh my. Went low carb in 2010, started carnivore in April 2024, nearly 15 years of hot flashes. Any idea what causes them and advice? Yes. So you definitely need to have your hormones checked. So if you go back and listen to the beginning, I kind of go over the different hormones that do that. Estrogen is going to you're probably very low in estrogen. Um, so that's I would just go through and hopefully you have a functional holistic practitioner that you can find to work with. And you can work with some online. I mean, they do this type of, medical office visits sometimes. I'm just fortunate that where I live, we have two functional doctors. One's an MD. They're both MDs. One's OB and the other one is like family med, does everything. Um, so yeah, I'm just very fortunate, and I live in a teeny tiny speck on the map place, and we've been that fortunate. But I would get with somebody like that, and get your lab work done. Write down all your symptoms, and if you go back and listen to this earlier, I go over kind of like symptom tracker, like write down how often these things happen, what happens, and I would do that. My mother went through hot flashes for at least 15 years um, and I don't and sweats. I mean, we'd be in my car. I literally bought a Ford Escape 12 years ago now, maybe 13 years ago. And I bought it purposely with my mother in mind because for one, she has bad joints and it was easier to get in and out than it is down in a car. And the other thing was it had climate control dual. Like I could control my side. And when I was taking her to her appointments or going with her someplace, she had her side because she would have her air conditioning on and it would be out frozen outside. And I was like freezing to death. And she would just be sweating. I mean, just completely drench her clothes 3, 4 times, in a 2-hour trip driving up to Iowa City and back. It was just crazy. And I was like, "No, no, thank you." Um, and I really didn't have that's not the type of stuff I had one night of hot flashes and night sweats, and it was the night that they took my uterus out that evening in the hospital. I had that just one time. That was it. But I still ovulated because I had my ovaries, for many years. See, I was 34 when I had that surgery, and I was 48. Yeah, 48, almost 49 when they just quit working, and I knew it. I mean, I knew immediately because I think it's called Mitchell Hyman or something. I could always feel which side was ovulating. And all at once it was like, "Nope, nothing." So, but I didn't have a lot of the other symptoms, from that. So, but I just want to reiterate that sometimes you do need a little bit assistance, and I don't want people to feel bad for being like, "Hey, I got pelleted," or "Hey, I got the cream," or "I got the patch," or even the pill. If that's what you works for you, so be it. I just want people to feel their best. And even eating as clean, as perfect as you can, there's just a point where we don't have the organs working to make these anymore. We have got to sometimes have that assistance. And I don't want people to feel bad about it. So, or to allow other people to make them feel less than, oh, you're not carnivore because you didn't do this. It's like the first time I said, oh, I had a fermented pickle with my supper, or I had 2 bites of fermented coleslaw or cabbage and carrots. And they're like, well, you're not carnivore. And I'm like, I could give a shit what you think. I'm not carnivore police and I don't really care what they think. They're not living my life. They're not in my body. They're not paying my bills. They're not feeding me and they're not, you know what. So they don't get to say so. And even the doctors, like I will work with them, and it's not that like everything I say to my doctor, I expect my doctor to jump through a hoop and do it, but I do expect them to listen and listen to the reasoning or me showing them the research. And then if they choose to like poo poo me or gaslighting pisses me off. And I will call it out immediately when that happens. And I do recommend everybody do that because I think the more people that would do that, they'd stop. Um, and you get it from everywhere. I've seen nurse practitioners, I've seen nurses gaslight their patients. It's unacceptable from any of the entities. I don't care who they are. It's not right. So you got to be your own advocate. So hopefully this was helpful. Like I said, if you think it was valuable information, please share it out. If you subscribe, there's a little notification bell there. If you hit that, sometimes it will notify you when I'm coming live. Sometimes it does not. They don't always like what I talk about. So sometimes my stuff is kind of in in the shadows, which is fine. I don't do well filtered and I don't like being filtered. So but I don't let it bother me. It's like it's okay. There's other platforms. I have Rumble, I have X, I have all the others. So that is fine too. So anyway, thank you guys for watching. Please watch this Sunday, and I think it'll be entertaining and educational. So I think it's a good thing to kind of see, somebody's before and after, and kind of go over those things and see. Denitra is, I believe she's a metabolic health coach. She might also be a nurse practitioner. I'm not positive. I've never met her per se. So we'll kind of see. But yeah, we're going to go over kind of like, how does the nurse look at this? How does this person look at it? How does Robin think about it? But I think it'll be good information. So anyway, I'm going to thank you guys for being here, even though this didn't have a ton to do with carnivore and keto. It somewhat does, just with what we do with our body. Hey, Brenda. So I will bid you guys farewell. Have a good evening. And as I always say, meet, heat, eat, and repeat. See ya.